All right. Hi, everyone. Thank you so much for joining us today. I'm going to get us started. So thank you for being here for our conversation today, how artists can address public health challenges. I'm here for a brief introduction before I hand it over. My name is Theresa Sweetland. I'm the Executive Director of Forecast Public Art and the publisher of Forward. So Forward is a brand new digital publication. I'm trying to advance here. Here we go. We launched it last week, and that's really what's sparking this talk today. So all of our guests are featured in the first edition of Forward in some way, and you'll hear more about that as we continue in the conversation. So I'm a huge fan of everyone on this panel. Thank you so much for being here, and to Mallory for facilitating today. So we're all coming from different cities. I'm speaking today from South Minneapolis. I'm on the stolen land of the Dakota people, and also in the community that still awaits justice for the murder of George Floyd. And I thank everyone for joining us. I encourage you to introduce yourself in the chat and let us know where you are today. So before I turn it over to our facilitator and our guests, I want to take a few minutes to introduce you to our organization, Forecast, and to the publication. So if you haven't heard about Forecast, we're a nonprofit arts organization and public art consulting and training team based out of St. Paul, Minnesota. We've been around for 40 years, founded by a group of artists who wanted to create opportunities for artists to work in public and community. Our mission is to activate, inspire, and advocate for public art that advances justice, health, and human dignity. And we do that in three main ways. So the first thing we do is we really support artists. We're one of the first organizations in the country to support specifically artists who work in public. We do that everything from funding artists ourselves to providing them with professional development to connecting them to work. We also help people and organizations and institutions who want to connect with artists, and we help them do that more successfully and also more equitably. So this could be anyone from a city to a hospital to a neighborhood organization or a housing developer, others. And we also build capacity and share stories and conduct research so people can do this on their own. So this could look like training for people who want to work at this intersection of public health and public art, or conducting research around racial justice in public art, which we'll be doing more of this year. So in our consulting and training work, we work extensively across the Midwest, but also are expanding more nationally. We work in large cities, but we also love to work in rural communities and in small towns. I'm from a small town in the Midwest. We love doing that kind of work and partnerships. We've been asked to come to the hills of Appalachia to the island of Oahu, which I can tell you with 6 inches of snow here today in Minneapolis doesn't sound like such a bad deal. Our team of consultants are practicing artists. We're facilitators, planners, architects, youth workers, curators, trainers. We're working on about 40 active partnerships around the country. And we've really made extensive investments in training and bringing more consultants of color into public art, public health, and community engagement work. And then finally, in all of our efforts, we really prioritize creating opportunities specifically for artists of color, Indigenous artists, local artists, and rural artists. And we want to see artists of color fully reflected in public art and public health initiatives nationwide. And we do a lot of help training and preparing artists for the opportunities that are present at this time. So if you're here today, you hopefully have an interest in how artists can help meet public health outcomes. We know here at Forecast that we're a part of many, many organizations, communities, committees, universities, practitioners that are doing this work, that care about this work, and that are building the values and platforms from this. And what we all agree on is that arts and culture are powerful partners in addressing the most vital public health challenges of our time, from racism to social isolation, collective trauma, chronic disease, and mental health, and more. There really, I believe, is no more crucial time to bring to bear all of our creative resources to heal this country. And I'm excited about that conversation today. And where Forecast is really most focused in this ecology and partnership of all of us is in the really practical ways that artists and creatives can connect up with public health opportunities. So one of the first questions people outside of the arts often ask when they get really excited about doing this is, how do I actually find an artist and how do I work successfully with them? So that's really what we love to do, and we love to help people do more successfully and equitably. So this new publication, Forward, was really launched. We launched it last week. It really was birthed out of this year's pandemic. When the pandemic hit, 94% of artists lost income, 63% are fully unemployed. We've spent the entire year finding any and all opportunities to support artists, create the conditions for artists to be successful, and connect them to communities and institutions. So this publication is our way to connect with people outside of the arts, to understand the value that artists and creatives can have in their work to really address these vital issues, whether that's the COVID crisis, systemic racism, the climate crisis, or more. And so our first issue is focused on public health. That's the conversation today. And this quarterly publication will come out tackling a different issue each time, with the hope that after people read, learn, and engage with the stories, the case studies, the tools, and all of you, that they will be inspired to work with artists and creatives on their public health needs. So feel free to reach out to any of us, to our team at Forecast, if you have interest in this work. And before we get started, I just want to acknowledge and credit ArtPlace and the University of Florida Center for Arts Medicine for their groundbreaking white paper titled Creating Healthy Communities Through Cross-Sector Collaboration, that heavily influenced the first edition. I want to thank them for their collaboration with us. And that white paper, along with other tools and resources is in our toolkit in Forward, and I'll include that in the chat, excuse me. So we're ready to get started. I'm going to introduce our facilitator today. I'm very honored to introduce Mallory Rukhsana Nezam. Mallory will introduce our esteemed guests. So Mallory is a civic artist, a consultant who believes that we have the tools to make places more just and joyful. She runs the creative consulting practice, Justice and Joy. She serves on the steering committee for the Planning for Health Equity, Advocacy, and Leadership Initiative, also called FEEL, and is a 2020 Monument Lab Transnational Fellow. She holds a Master of Design from Harvard University. So Mallory, I will hand it over to you.
Thank you, Theresa. I've loved seeing all of your introductions in the chat as well. Hello to everyone joining us today. I am so excited for this conversation. I'm also really excited about Forward, the new platform that Forecast has launched. Lots of great resources around this idea of how artists can engage in public health. I'm calling into you from St. Louis, Missouri. It's my hometown. I'm sheltering here. This is the unceded land of the Osage, Kickapoo, Sioux, in Miami. And I am here to facilitate our conversation with three incredible panelists, Dr. Mindy Fullilove, Miguel Angel Vazquez, and Elizabeth Hamby. So honored to have them here. I am going to introduce you to the three of them as I share my screen. Wonderful. So Dr. Mindy Thompson Fullilove is a social psychiatrist and professor of urban policy and health at the New School. Since 1986, she's conducted research on AIDS and other epidemics of poor communities, with special interest in the relationship between the collapse of communities and decline in health. From her research, she's published numerous articles, book chapters, and monographs. She has also written The House of Joshua, Meditations on Family and Place, Root Shock, How Tearing Up City Neighborhoods Hurts America and What We Can Do About It, and Urban Alchemy, Restoring Joy in America's Sorted Out Cities. A third edition of Homeboy Came to Orange, A Story of People's Power, which she helped her father, Ernest Thompson, write, was released in May 2018 by New Village Press. She's also the co-author with Hannah L.F. Cooper from Enforcers to Guardians, a public health primer on ending police violence, issued by Johns Hopkins University Press in January 2020. And then her latest book, Main Street, How a City's Heart Connects Us All, was released in September 2020 by New Village Press. Welcome, Dr. Fullilove. And Elizabeth Hamby is joining us today as well. Elizabeth is an artist who serves as the director of Take Care New York at the New York City Department of Health and Mental Hygiene. Take Care New York is the city's health equity roadmap. Elizabeth leads storytelling campaigns, develops multi-sector collaborations, and designs policy to eliminate health inequities and advance social justice. Her art practice includes projects across media that make complex issues legible and help people work together. She has led a waterfront planning studio out of a neighborhood laundromat, formed a bike collective to address transportation issues in the Bronx, and worked with youth in public housing to develop haikus about littering. Her work has been exhibited at the Museum of the City of New York and the Brooklyn Children's Museum, among other venues. She holds degrees from Eugene Lang College and Parsons School of Design. Welcome, Elizabeth. And we also have joining us Miguel Angel Vazquez. Miguel is one of the first planners hired by a public health department in the nation. His role at the Riverside University Health System is to strengthen the integration of planning and health through collaboration with non-traditional partners. Over the past 18 years, he's provided professional planning and community development services to the private, public, and military sectors. He received a bachelor's degree in urban studies and planning from California State University, Northridge, and is a fellow of the California Leadership Academy for the Public's Health. The APA, American Planning Association, has recognized his leadership and projects with numerous awards and recognitions, including APA's President's Award in 2018. And I also want to add that Miguel is the steering committee chair of a new initiative called FEEL, which stands for Planning for Health Equity, Advocacy, and Leadership. He's also involved in the APA's, American Planning Association's Arts and Planning Interest Group. Welcome, Miguel. What a stellar team. Sorry, Miguel, I didn't put your photo up. This is Miguel. So glad you all can join us today. We are going to have a conversation with our three panelists, and then we're going to open up for questions and answer session at the end. So as you all are listening to the conversation, if you have questions, just know that we will have some time at the end for you to ask them, and you will ask them in the chat. So as Theresa mentioned, we have always been living in a time of health disparity, but right now we're living in a time of multiple crises very directly related to health. And this is the context in which we are having this conversation. And this is not the first time that we have experienced this kind of collision or piling on of multiple health crises. As Mindy Fullilove wrote in the intro to Forward, she has been doing this work for a long time and has been working with artists for a long time and has had a lot of experiences working with artists around the AIDS crisis. So I want to ask our panelists sort of a broader question to start our conversation today, which is, how have you witnessed artists in general helping to address public health challenges in your own work? In what ways have you witnessed artists addressing public health challenges?
I guess I could start with one quick example. But before I go into the specifics of it, I think it's important to think about the full spectrum of public health and how it touches every single part of our humanity. So in this particular case, I'm going to refer to the need to provide shade for people in places that are experiencing extreme heat. And you would be surprised how much being under shade protects you from the burning power of the sun, if you will, in some areas. So I'm referring particularly to bus shelters. I work in a community, or I've done some work in a community that for the longest time has been asking for these improvements. Actually, this was as a result of a collective of youth who did a photo voice project to do a contrast between one particular area in the Coachella Valley and another one, in which the wealthy area actually has bus shelters that are public art installations. And, in this other part of the valley, in the eastern Coachella Valley, there's places that don't even have a sign. People just kind of know where to stand to get the service. So at some point, as a result of that, we wanted to assist and raise awareness around the importance of, the need for bus shelters. And a couple artists from the Coachella Valley who have been operating there for many years. They we approached them to see if they could help us to build a makeshift bus shelter just to do a pilot kind of project. And they were willing to do it without any, without asking for any compensation um, or anything in return. But what they wanted to see was to, the outcome really was to expose that need for these very basic piece of infrastructure, which actually it's pretty complicated to get. Not because there's no money to buy it, but there's layers and layers of bureaucracy that we need to go through to be able to provide that. So in this case, these two artists were instrumental in helping us to get the message out. And to the day, the bus shelters are still not there, but a seed has been planted, and it's a long process. It's a long journey to improve our community's health. But the participation of the creatives is absolutely important because they can help us to see the world in a more imaginative way. So that's that.
Thanks, Miguel, for kind of sharing an experience that you have had. I know, Elizabeth, you work both kind of as an artist and also as a director of your program. So I'm sure you have a lot of examples of how you have worked as an artist in public health. But I wonder if you can pull out for us where you tend to see some of the greatest impact.
Yeah, absolutely. And I love the example that Miguel shared. I want to offer kind of a different way of thinking about this and thinking about the skills that artists bring to work outside of traditional art practice. And so in my work, one of the things that I do a lot is figure out what the question is. One of the skills that we build as artists is an ability to dwell in ambiguity, in complexity, in discomfort. And that's a place that is certainly very acute right now, but is really kind of an ongoing condition in work around public health. So I'll tell a story about myself. When I first came to working in public health and working at the New York City Department of Health and Mental Hygiene, I was so awed by the epidemiologists, the scientists, the public health experts that I spent time with. And I was listening and learning and thinking and working. And one day I sat one of my most dear colleagues, Dr. Zinzi Bailey, who is really just an incredible thinker in terms of structural racism and its impacts on health. And I sat her down and I said, Zinzi, can you tell me what creates health? And she laughed because of course that is the question. It's the big question that we all are grappling with and all are wrestling with in our research, in our practice, in our programs, in our initiatives. And so I think that one of the things that I do as an artist is kind of provide that lens, that outsider perspective, to ask these questions that have ultimately been actually quite generative for me and for my colleagues for many years now. So I'll offer that as a different lens.
So prompting us to actually consider what is the question at the core. Dr. Fullilove, I know that you have also worked with artists in many ways. I wonder if you could share a little bit about an experience that you have had working with an artist in the context of public health.
So I've worked with many artists in many contexts, and one of the ongoing partnerships with artists is a project called City Life is Moving Bodies, the Climb Project, which was a project to connect a series of parks in northern Manhattan and to make a trail, a hiking trail, and that we call Giraffe Path. So early on, a student of ours who was involved in running a program for youth and arts said that she could help us get this trail going, and we needed to connect the parks, and we didn't really know how to connect the parks. And she said, well, we'll do some art and that will help connect the parks. And it turned out that we had this idea of the giraffe, and so the idea came to be that what they would do is teach children how to make giraffes. These and that every year how they made the giraffes has evolved, and what the giraffes look like is, you never know. But on this sort of first Saturday of June, which is Hike the Heights, all these giraffes show up and get placed in the parks. And it's quite extraordinary to see them. And it, really created a sense of, I think, commitment and engagement with the park, and has been just wonderful. Just to support Elizabeth's point about artists really having ideas, I mean, I really didn't know how we were going to create the idea that these separate parks could be a single trail. So the idea that art could get us from one place to another really came from artists, and has been a great thing. So the New York Times highlighted the Giraffe Path as one of 5 trails in New York City where you could feel that you were outside of the city. And that's thanks to a lot of giraffes made by a lot of kids.
That sounds like a great project. I am also, one of the ways that I think about the role that art and artists can play in the public sector in non-arts context is I often think about what are some of the biggest problems and challenges with that sector, so public health, and how can artists and culture bearers help address that? So if we start at kind of what are the biggest challenges, what are the problems? If we're framing it that way, I want to ask you all, how can art and artists help us address some of the core problems with our public health system, and the disparities within it?
Maybe I could start. I think that, Elizabeth's question, what is health, is actually, you have to answer that question first, I think, before you say, here's where you can help. And my research group, the city's research group, has really focused on that health thing. What is health and how do you get to it? And if health is our ability to function and to love and to work and to be a society where people care for each other, then you get to it by building you have to build both the physical and the social base, and you have to share resources. Now, in this nation that we live in, the United States of America, we've destroyed the foundation for health. And we all know that at this moment, we're a deeply divided nation. We're at each other's throats. And so if you said, what is the most important thing, you could say something like, well, mental health, but you'd be better off saying, how are we going to put it back together? And, it's sort of like our 5 parks. How were the parks connected? We have all these groups of people that are disconnected. How are we going to connect them? And there, I think art helps, both because artists have said to me that part of what art is seeing reality. The artists see what's in front of them. And so they're a little bit ahead of us. The rest of us, and I say this as a psychiatrist, the rest of us like to be in denial. So to the extent that the artists can say, no, this is the big question and here's how we're going to deal with it, we're in a very desperate situation. And anything else that you say, well, we need housing, we need this, we need that, is secondary to the national crisis of division.
Yeah, I think that's 100% right. And I think it might be helpful just to take just a very brief kind of step back and look at just a little bit of how we got here. You know, the origins of public health were really in the prevention of communicable disease, right? So figuring out how to make sure that we had light and air, that we had clean drinking water. But around the 1970s, the shift from a primary focus on communicable disease to a primary focus on chronic disease really meant that we moved from thinking about systems and environments primarily to really thinking about the behaviors of individual people, telling people to quit smoking, to exercise, to eat healthy, all really good advice. But what we lost sight of was the way that those systems and environments, contributed to our ability to enact those behaviors. I think right now, even before the pandemic, the field of public health is in the midst of a paradigm shift. And the pandemic, I think, has made this unavoidable. The racial inequities in health are the public health crisis of our time. And we can't get to them through individual behavior change strategies. We can't tell people to stop being racist on a big poster and check the box and say that we're done. We have to dig in. And the piece that Mindy highlighted around the relationships, the trust that has to exist within communities, between communities and government, the hard work that we have to do right now is figure out how to rebuild that trust. And I think that what artists offer is the opportunity to start small, to think about the small interactions that we can have with each other that allow us to build familiarity, that allow us to build rapport, that allow us to build relationships that can then serve as a foundation for the larger changes that we want to see in the world.
I agree with all of those comments. I think in public health, we go back to the model of the social determinants of health. And I think everyone should know what that is and how it works. When I finish my thoughts, I'll put a link to a model developed by the Bay Area Health Inequities Initiative, BARHI, which is an amazing model in which we can understand how the traditional and the emerging public health practice is leading us to, and Elizabeth really hit the nail in the head. One of those areas that we need to focus is addressing systemic racism if we want to work in what in public health know as working upstream, still prevention, prevention work. So before a hate crime happens, well, what needs to be done to prevent it? And, we need to have these difficult conversations to get us to a point in which we can be more united. But the other thing that I wanted to say, I think, the public health aspect was really well covered by Mindy and Elizabeth, but there's this piece of, who is the artist? What is art? It's always, lingering in my mind because I have a struggle myself with that. I consider myself as an artist because I doodle and I toy around with things and I make things with my hands. And, since I was a child, I was drawn to create, but I never got a title, a formal title. And in fact, my mother said, if you want to struggle in life, become an artist, she said. And that was, I think, the wrong message because, that was something I really wanted to do. And, eventually I became a planner, but that didn't dissuade me from creating. So I'm saying this because I truly believe, and probably you all agree with me, that every one of us, in every one of us, there's an innate artist that we need to, if we are not exercising it, exercising our creativity and imagination, we have to find ways to reignite that in every single individual. So I think our approach could be of, tapping in the talent of those who have discovered the path, those who have been able to be encouraged to express themselves. But how do we also work with those of us who have been, I don't know, suppressed to express ourselves, especially when we work in government and in the private sector? I think we need to be able to formulate a message in which perhaps that expression becomes or common denominator to communicate amongst disciplines that sometimes it's really hard to understand what they do, or people don't even know that they exist. People don't know that planners exist. I think I would venture to say that before the pandemic, not a lot of people knew or thought about public health in the sense of the practice, but now, it's front and center. So this is an opportunity to use the power of the art to communicate complex and difficult concepts to that are needed to make that change. So I just wanted to add that to the conversation.
Yeah.
Miguel, I will endorse you as an artist.
I
Thank
can't tell you how many artists turned planners I know too. Something there. But Miguel, I know that you work in such a collaborative way, in a very cross-sector manner. I think all of you really do. So I'm thinking about this idea that you're generating for me, Miguel, of what is the artist? What is the art? Oftentimes, myself and other colleagues will call it creative problem solving. It's arts and cultural work. It's also creative problem solving. It's imagination, it's curiosity, it's courage, it's expression. So I'm curious how you all think about, there are a lot of different ways that we can imagine how artists are a part of public health solutions, systems, and change. And I see it in kind of two different ways. Like, one is bringing an artist in to do a project, right? And then another one is kind of bringing both an artist, creative problem solver into a system to kind of change the culture of how it works, to change the system itself in a more kind of sustained and long-lasting change. So I'm curious what you all think about as kind of like a theory of change, I guess, for the relationship between arts and culture and the public health system itself. How might artists help support the shifting of the system?
I can offer a couple ideas. And, as you were speaking, I think in my mind, I see two approaches. One is a formal approach, and another is more informal. The formal one, if we're able to put into our contracts, into our existing policies, explicitly the participation of an artist. Let's not define what the artist would do, but if you put that into a document, it's formalized, and that's how your process will work. And then at the other end, you have the informal participation of artists. They don't need permission to express what the needs of the community are or to bring people together. They can come together, bring a collective of people and turn them all into artists. You know who does that really well? And I think he's here today. My very good friend, James Rojas. He, I think you all know him. He does that. He doesn't need permission to bring people together and actually empower them by making them feel that they're designers without any formal training. I think his approach, he's placed place it approach is pretty brilliant, and it can be translated or transferred to other ways to create, as you said, creative problem solving.
Yeah, absolutely. And I think another piece of that, and I think I saw some of this coming up in the chat as well, is really about stories, right? And thinking about the power of our own stories that we tell ourselves to help make sense of the world, and then the stories that we tell each other to shape those relationships. So, Miguel highlighted James Rojas' work. I know Christine Wang Yap is also here, who's done a lot of really incredible work in this space. But I think one of the things that artists can do is actually bestow this power of creativity, from our anointed position. Not really, but to kind of create the conditions for us to more fully become the artists that we are inherently. And I think just to kind of stir the pot a little bit, I want to acknowledge the fact that the impulse to put us all into these very tight categories, into these very neat boxes, is a white supremacist impulse, right? And so as we're thinking about how to undo structural racism as the fundamental work of creating public health right now, I think it's important to notice that's a very specific issue that exists, and artists and their ability to move between spaces and to assume positions that maybe they weren't allowed into, but they stepped into them anyways. I think that's something that can and should be acknowledged.
Elizabeth, I just want to say one ought to say class and race and all the isms, because not just structural racism. Wages have been flat for working people for 40 years. And this is part of what Trump, the terrible feeling that creates is part of what Trump is calling on. And while wages have been flat, prices haven't been flat. So all of us have been suffering, and we used to have jobs with unions and pensions, and now we have gig work. So we have to be very aware and not, I think when you say it's only structural racism, a lot of people feel left out, and they shouldn't be, because they are really suffering.
Mhm.
So we have to think big here. Mallory, going back to your question about the structure of public health, like urban planning, is a structure of the state. And as we know, urban planning in the United States comes out of urban renewal, which destroyed communities all across the nation. So a lot of the history of American urban planning is quite terrible. I'm sure Miguel knows that history and is not a part of it, but it's definitely part of the profession. Similarly, public health did the Tuskegee syphilis study, right? And public health, if you think about all the pressure the CDC has been under with their advice around the pandemic, they've been under a lot of pressure from the government. And that is always the case, that what the CDC can say is not purely from science. They've never had that freedom. It's always a negotiation with the political system. So to say that artists, how to include artists in the public health system is one task, but public health is not entirely tied to the part of government that has those responsibilities, like the New York City Department of Health and Mental Hygiene. It's also what everybody does everywhere. So, and I really appreciate this conversation that Miguel raised about who's an artist. So when we were working in Washington Heights in the 80s and 90s, it was a lot of murder. And when people were killed, people would put up murals in memoriam. And these murals would become altars to the people who had been lost. And then the altars would take on very formal mourning roles in the neighborhood. And everybody who brought a teddy bear or a candle to the mural was an artist in that public space and saying how they felt about the violence in the neighborhood. And this is very important for the eventual suppression of the violence, was people mourned those who were lost. So, and this is at a time when, what the city and the state and the federal governments were doing was mass incarceration. They weren't doing anything helpful. to stop the violence. So we can't get too tightly into these structures of the state, because the state is not always operating. The state is operating at this moment very much under the control of the corporations. So artists, to the extent that we want to act on behalf of the people, we have to be, you can be in the system sometimes, but you may have to be outside the system a lot of the time if you're really going to speak for the people and speak for the processes of liberation from class and race and sexist and all those, patriarchy, all of the oppressions that keep us suffering.
One strategy that I'm thinking on right now, for instance, I think the group that Leonardo Vazquez runs, the Consortium for Creative Placemaking, I think that is actually a strategy to grow the artists within public organizations. I think it's one important tool. And what I'm trying to say is that perhaps there could be an opportunity to create some type of more specific program. So sort of like in planning, we have the AICP, right? We have an extra credential. What if there was a program that could, I don't know, as Elizabeth said, bestow people on, you're an artist, but for people who are within public agencies, because working for government can be very powerful. We are the doorkeepers of policy. We make policy. I mean, there's intricacies with that, obviously, or elected officials are the ones that ultimately make the final decision on policies. But what if also that was part of, bringing that idea of using the arts for policy making, maybe even a credential for elected officials? I think that would be kind of cool. Anyway, I'm just kind of thinking out loud now.
I love
Well,
it.
I mean, I think it's I think it is a compelling idea, but I wonder if, um, rather than thinking about a formal structure, what are the kind of rhizomatic connections that could be formed deep underground that could allow art and artists to spring up where and when opportunities emerge and arise? Like, what would those deep connections look like? And I think, again, just to kind of step back, this is the kind of visioning that we should be doing right now. This work of visioning is so critical. And so I'd love to keep answering questions that start with what if.
Well, luckily, I think artists are pretty great at self-organizing, and there is always underground rhizomatic connections happening. And Mindy, to your point, I think it's been an interesting moment for me to watch artists both working within the system and outside of it. And I think they always have been, but I notice in this moment that there is an attempt to kind of formalize the role of the artist inside of public systems. So it's just sort of an interesting moment in time when we're trying that out a bit more formally. We have just a few minutes left for our group conversation, and then we're going to open it up to everyone else. I'm gonna read a quote from Dr. Fullilove, and then I'm gonna ask you all to do like a rapid fire 1-minute response, just for fun. So continuing to talk about the civic realm, democracy. So in our forward article that Dr. Fullilove wrote, she says, "The partnership with the arts, in my experience, has meant expanding my understanding of how to connect people in ways that inspire them to healthier living. One piece of this is that much of healthier living has to do with the inclusion in a functional democracy rather than the enactment of self-care. Toothbrushing is essential, but if the police are going to knock your teeth out, you have some bigger problems. Motivating people to vote, to go to city council meetings, to join their block watch. These are even more fundamental public health behaviors that we must encourage." So my question to you all is, how do you think about a healthier democracy as part of an improved public health structure? And how does art assist in that process?
So something that I've been thinking about a lot lately is an idea that the artist Marisa John has been working on for years, which is the idea of reimagining our care force. Who are the people that take care of our communities, of our cities, of our country? And how do we imagine and support them as a collective? So there's some work that exists in public health right now, important work to think about community health workers, people who are doing person-to-person health work in the neighborhoods where they live. But beyond that, there are other kinds of care workers, childcare providers, people that take care of the elderly, but also the people that take care of our parks, people who have been revealed to us as essential during this pandemic, the people who work in restaurants, grocery stores, all of those things. So as we're reimagining our democracy, how might we imagine that collective as a care force and think about policies, systems, and structures that can support them to improve their ability to function as a network and a collective, as well as their individual standing in the world.
I think I can go next. And I'm also reading at the chat, and I think this is related to your question, Mallory. Question from Karen Atlas. I think, I'm thinking about field, for instance, right now, the planning for health equity advocacy and leadership that we launched about a few weeks ago. And the intention of that project, or one of the pieces of it, is to develop coalitions of different disciplines that actually have a how would I say it, a similar kind of purpose or goal to improve the health of our communities. And planning, it's a big part of it. Public health is a big portion of it, and certainly the creatives are part of that. So there are formal organizations, professional organizations that need to coalesce, but there's other organizations that work probably not necessarily at that level, that actually are making tremendous impact, that also need to be connected. So understanding the landscape of all the different players that can help us to advance, as it was said, the future of democracy needs to happen now, and we need to come together. And these collectives that are popping out, we need to know who they are, and we need to come together to the table so that we can build the power that is needed to ensure that that vision for a new democracy, if you will, moves forward. So that's my closing statement.
We're in a time of these converging crises. As everybody knows, that the pandemic and all the oppressions and climate change. And I think it's nearly overwhelming and nearly paralyzing. And I think it's having many unconscious effects on people. If you can't predict the weather, what can you predict? And I think people are feeling such a deep unease about the future that they get mad at other people. And that's partly why Trump could stir up the racism, because people want somebody to be mad at. You can't fix the climate, but you could yell at the immigrants. And so the issue before us, I think, is how do we start to have some space in which we can say, yep, a lot of problems, let's get busy. And that is beyond our ability to, we can't just say it. It's got to come forward in ways, and this is where the arts come in, that they transcend mere words, and they transcend numbers and statistics, and they grip us in some profound way so that our consciousness can expand to say, yes, we have troubles, but we can go forward. And this has happened so many times in life, right? John Brown attacked Harper's Ferry and was hung for his attack on Harper's Ferry. But the song John Brown's Body lies moldering in his grave was sung by soldiers of the Union Army, and it helped them. Emerson's poem, The Voluntaries, stirred people to go fight in the war. So this is much bigger than working in a public health, whether it's inside the system or outside the system. This is rescuing all of life. 1 million species hang in the balance, right, including our own. And I think it's the arts can go that deep and can take us that big. And I hope the artists will do it.
Well said.
Thank you. Thank you all. We are going to bring some other voices into our conversation and open up our time for questions. If you all would use the question and answer function in Zoom to ask your questions, we will field them there. We have a question here from James Rojas, which is about how does using, as an artist, this is specifically for you, Elizabeth, how does using objects change planning and planning health outcomes? How have you experienced that, or either Mindy or Miguel as well?
Yeah, so I've been very lucky to work with and learn from James Rojas for many, many years, and to use his technique of using small objects and kind of community-built models to facilitate conversations about imagining what a future could be. And I think a lot of the times in kind of formal community engagement processes, I think this is less about public health in particular, but more, to Mindy's earlier point about how we as the state interact with people. And a lot of times that is about kind of asking people very concrete this or that questions. We're going to build a new park in your neighborhood. Do you want red benches or new benches or blue benches? But of course, nobody actually wanted benches. They wanted garbage cans, or for the lights to be fixed, or, a new after school soccer program, for youth in the neighborhood. But there's no space to have that real conversation. So James's tools, for me personally, as an artist and somebody who gets to have these conversations with communities pretty regularly, they have created the space to have these much more open-ended, much more transformative conversations that, to my earlier point, really help us get to the actual question that we're talking about, rather than a simple this or that conversation.
Thank you. I'm going to ask a question a bit broader for all of you, and I think this might be the question that we end on. This is from Abigail, who will be receiving her planning degree this coming spring. And she's saying that she feels lost and overwhelmed as to how to kind of integrate art into her practice. And she's often told to start something herself, but feels like she doesn't have the knowledge or skills to know how to do that. So what are all of your thoughts on how someone might get started in this kind of work, especially if they're coming more from planning and health and want to integrate art into their practice?
I can start. I think that you just have to start. And so I would suggest starting small. Find a small thing that you can do yourself, whether it is the way that you facilitate a conversation with your colleagues or with communities, whether it is the design of a poster or an infographic or a meeting. Find something small, just one thing small that you can do with the resources and the power that you have, and do it, and then do it again, and then do it again, and then do it again.
What I would add to that, certainly it's important to, to get yourself going, to be a rebel and say, the heck with it, I'm just going to do it. because I've done it. I asked the same question myself many years ago, and I was just like, I have this desire to communicate planning concepts. So I'm just going to use photography. It's easy. You just get out, you take pictures, and they're your own, and then you play with them, and then you tell others what is it that you saw and how it's related to whatever you want to talk about, planning or public health. But I think what is important also, it's good to do those small efforts on your own, but begin to find your people. Find another friend or colleague or student from your program who thinks alike with you, and start a project together. It's being in company of others. It's so rewarding. And that's how you grow actually a movement. You just need to have an idea, and then somebody else who supports your idea. And then and the way you works, then you tell others, oh, I'm working with so-and-so. And then they said, oh, this is really cool what you guys are doing. I want to be part of it. And that's how you grow it. But yes, you need to first kind of self-reflect and find what is it your passion and the thing that you want to communicate, and use your creativity. Again, you don't have to be formally an artist. You can just call Elizabeth and tell her, Elizabeth, I'm an artist. She'll say, yes, you are, go for it. And, just keep it, repeat. Yeah. Do one thing and then repeat and repeat, but bring others to the table.
Abigail's question, she said she felt lost and overwhelmed. And the thing when people feel lost and overwhelmed is that in a way they want some certainty. But I don't think anything that Miguel and Elizabeth or that I'm saying is about certainty. It's about process. And there's a lot of times in the process where you feel lost and overwhelmed. So some of that is about how do you welcome feelings that are uncomfortable, that are dysphoric. Because part of the process of doing the new, stepping outside the box, is very uncomfortable. So that's about, and that's what keeps self-help books in business, is when we feel lost and overwhelmed. But it's not a bad feeling, it's a good feeling. So in the Bible, it says, pray all the time and have gratitude for everything, which was advice to some really early Christians who were living in very strange, weird times. They're getting thrown to lions. So pray all the time and have gratitude for everything. I just think it's really helpful advice. So have gratitude for your feelings of being overwhelmed. And the specific thing I want to say is, in Zoom, there are whiteboards. So every time you're on a Zoom call, say, let's use the whiteboard. And then that'll just give you some space to be creative.
Thank you. And I love that folks in the chat are offering to connect with Abigail directly. And Mindy, thank you for pushing us to lean into the uncomfortable. I think that is very much the truth of this moment, and also giving us a sense of hope too. Thank you all so much. I am going to hand it over to Theresa. We are almost at time, and she's going to take us home. Theresa.
You're on mute.
Thanks, Mallory. And my mute button. I'm just going to share one more thing here. So thanks everyone so much for being here. Thank you for this incredible conversation. I'll just add that Abigail, as somebody who finished a planning degree and decided to work in arts and social justice, happy to talk to you as well. I wanted to just share that Mindy has a new book that's just published out in September, Main Street, How a City's Heart Connects Us All, through New Village Press. So please make sure to check that out as well. Also wanted to share that back to Forecast and our work. And I know there's so many people, and I appreciate everyone in the chat and the conversations of all of the networks and incredible practitioners and colleagues here today. One of the offerings that we have at Forecast is a training we've developed around public art and public health and this intersection. If you're interested in doing this work, we piloted this work in 5 small communities in southern Minnesota, with using the social determinants of health with connecting government with artists in those communities. So we look forward to sharing that. And I'll just say that this was our first conversation with our first publication. I just couldn't imagine it going better. Thank you so much. Our next one will be in February when the next issue of Forward comes out, focusing on transportation. And every quarterly issue, like I mentioned, will focus on a new topic. After transportation will be public and community safety, and then we'll also be focusing on food and agriculture in the coming year. So if you have other topic suggestions or conversations that we should be focusing on, I look forward to hearing from you so that we can really have an open dialogue and conversation about where Forward goes, because it's a dynamic platform. We can continually be building it, adding more tools and resources to the toolkit section in particular. So if you have tools and resources around the topic of public health that you feel like we should have included, please send those to me, connect with us, info@forecastpublicart.org, or feel free to reach out to me directly. I know there was so much shared in the chat and resources. We are recording this and have collected those. So if you weren't able to grab those now, please reach out and we can share those with you. So again, just wanted to thank everyone for your time, for being here with us, to all of our esteemed guests for being a part of this. And I hope you have an incredible rest of your day. Thank you.
Everybody, bye.